Okay, so today we shall be discussing hyperthyroidism and the diagnosis of hyperthyroidism. So, hyperthyroidism is a condition in which T3 T4 level is increased in the body, and how we can diagnose the hyperthyroidism. So, for diagnosis of hyperthyroidism, just we have to look on which type of disease it is. There may be Graves' disease, and in Graves' disease there are different clinical features and clinical presentations of the patient, like eyes will show proptosis of the patient, skin finding will also be there, and subacute thyroiditis. In subacute thyroiditis, patient will complain of tender thyroid, because on examination, on touching the neck of the patient, on examination of the thyroid, patient will complain tender thyroid. And in painless silent thyroiditis, patient will have non-tender normal exam results. Non-tender thyroid will be there in painless silent thyroiditis. And exogenous thyroid hormone use, the patient will have a gland that is not palpable, because patient is using exogenous thyroid hormone like levothyroid and thyroxine. So patient will have increased thyroid hormone. And in pituitary adenoma, there is high TSH level in the serum, because the main cause is in pituitary gland, from where TSH level is increased, release, and that TSH level is creating condition of the hyperthyroidism. So in these examination we use and diagnose the thyroid hyperthyroidism. And different disease like grave disease will present different clinical examinations, and different clinical features will be presented by the patient. And lab findings of hyperthyroidism, we will perform labs in order to diagnose. In Graves disease, there will be low TSH and elevated T3 T4, and positive antibody testings will be there. In subacute thyroiditis, there will be low TSH and tenderness of the thyroid will be there. Painless silent thyroiditis, there will be low TSH level and no other any finding will be there. In hormone exogenous thyroid hormone use, there will be low TSH level, low serum TSH level, and increased T3 T4 level will be there. And there will be non-palpable gland. In pituitary adenoma, there is high TSH level, and MRI of the head is confirmative diagnosis for pituitary adenoma, because the cause in pituitary gland, that's why excessive amount of thyroid stimulating hormone is released. So how we can treat the hyperthyroidism in Graves disease? We treat the patient with radioactive iodine. We infuse the radioactive iodine, and that goes into the thyroid gland and destroy the affected part. In this way hyperthyroidism is treated. In subacute thyroiditis, we give aspirin to the patient. And in painless silent thyroiditis, there is no specific treatment for painless thyroiditis. So that was diagnosis of hyperthyroidism, and in next video we will discuss another endocrine diagnosis.